Good morning, everybody. This presentation is to share the results of the efforts made by Union of People Living with HIV of East Europe and Central Asia region on scaling up access to ARV treatment in the region during the period of 2013-2014. And first of all, I would like to tell a few words about the Union. It's a regional network of people living with HIV networks from 16 countries. It was established in 2005 and registered in 2007. And ECUO Secretariat is based in Kiev, Ukraine. ECUO members are people living with HIV organizations from 16 countries of the region. And the mission of ECUO is to increase the influence of people living with the HIV community on scaling up access to timely, comprehensive and qualitative treatment, care and support for adults and children living with HIV in East Europe and Central Asia through effective partnership and active advocacy efforts. And the background to start the activities I will describe in this presentation was that the Eastern Europe and Central Asia is a region with the fastest growing HIV epidemic in the world. Access to ARV treatment generally in the region is the second lowest in the world, with only 25% of people in need of treatment receiving it at the end of 2012. Main donor supporting ART procurement for almost entire region except of Russia, the Global Fund to Fight AIDS, Tuberculosis and Malaria, is phasing out its current funding. All the governments should be forced to allocate public funding and gradually overtake full responsibility for ARV patients enrolled through GF grants. As a response to that situation, the regional advocacy campaign, Health Can Be Bought, the price is included into budget, aimed to increase public financing for ART, was initiated, elaborated and implemented by ECUO since April 2013 in 7 countries as a part of the ECUO regional advocacy strategy on ensuring sustainable access to qualitative treatment for all who need it in the region. And the territory and partners of the campaign was Armenia, Azerbaijan, Belarus, Georgia, Moldova, Russia, Ukraine. All of these organizations are people living with HIV organizations. First of all, the national advocacy action plans were designed to, these plans were to amend laws and make governments responsible for public funding for ART in these countries. And more than 40 separate activities aimed at the attraction of stakeholders' attention to the issues of access to ART were conducted in 7 countries under one slogan, one branding and one messaging. Roundtables with officials were conducted, press conferences, petitions, street actions, movies a lot of movies were made and filming, and it was everything of that was made under the one slogan, one branding and messaging. The special logo of the campaigns was designed and used for every informational and promo material created within the framework of the campaign. It looks like the stamp and the signature used by the governmental officials when they put their resolution on the documents with their decisions. The decision that health can be bought, the price is included in the budget, is the content of the signature and the stamp. And the main messages of the campaign used by the countries were health can be bought, the price is in the budget, there are drugs, there is no time, treat today, save tomorrow, HIV is not transmitted when treated, treatment is our right, your obligation is to treat. And also the map symbolizing the region and the people affected by HIV in the region also was used within the frame of the campaign. Before starting the campaign, people living with HIV organizations were educated how to conduct the campaign, and more than 30 educative workshops were conducted and more than 20 technical support visits took place. Also, ECUO initiated a Thank You for Cooperation Award to enlist authorities' support on the issue of ensuring the treatment for people living with HIV for the state budget means. You can see some pictures from this awarding in the countries. That picture shows the example of the campaign in Ukraine. It was named I Have a Power to Live, and the photos of people living with HIV who are on treatment were placed in the biggest cities of Ukraine during the long period of time, and it increased the awareness of people and of authorities on necessity and benefits of early start of treatment. This is an example of the campaign in Belarus. In Moldova, autocross championship gained more than 5,000 of participants. 46 autopilots called "There is a treatment, there is no time." The TV debates with participation of the Ministry of Health, the head of Parliament Commission on Health and Social Protection, and the representative of people living with HIV League of Moldova were conducted. In Armenia, a public campaign Protect Our Society from AIDS, aimed at familiarization the wider society with the conceptual vision of treatment as prevention and the concept of community viral load, was conducted. In Russia, there is a little bit different situation than in other countries of the region. 100% of the state funding for ART, we already have it. But the main problem, the centralization of ART procurements, which leads to treatment interruptions and overpricing. As a result of the campaign, in 13 regions, the community representatives have been included into the regional public councils for protection of patients' rights, and street actions and press conferences were conducted, and also all Russian Union of People Living with HIV took part in the public monitoring of treatment interruptions initiated by ITPCRU, Patient Control, and other civil society organizations. Also, ECUO constantly conducts regional monitoring of access to ART treatment in our region, and we create the country profiles on access to treatment, which we put to our website, and it's our advocacy tool as well. The results of the regional campaign are the following. Firstly, Azerbaijan will allocate 100% of the state funds for ARV medicine in 2014. In the previous year, it was 20% less. In Ukraine, the government approved a draft law on ratification of the National Target Program to combat social HIV infection AIDS for 2014-2018 years. The program fully addresses to the needs for ART public procurement, reducing the morbidity and mortality from HIV/AIDS by providing quality and affordable health care, especially among high-risk groups, as well as services for treatment care and support for people living with HIV, was laid down in the program's basis. Unfortunately, due to political unstable situation in Ukraine now, it still wasn't approved. In Russia, people living with HIV unions representatives were included to the regional councils on patients' rights protection, which provides an additional opportunity to lobby for their rights on access to treatment. For Russia, it's also the big achievement. Armenian and Belarusian governments officially confirmed their readiness to ensure sustainable access to ART after GF phase out. In Armenia, state budget for AIDS program was increased for 14%. First time ever in Belarus and Moldova, ART are partially procured for the state funds. And in 2013, Global Fund has agreed on prioritized scaling up ART, safeguarded by state budget, the approach promoted and pursued by ECUO, and included transition plans for ART patients enrolled through the GF grants to be pick up, transferred to the public funding presence as a requirement for country application. Such transition plan was already endorsed by Georgian government due to the efforts of their people living in the HIV community. Of course, we cannot say that these achievements were made only by our organization, but it was a joint effort of other partners and even officials and international organizations, and our donors also supported us, and we are grateful to them very much. There were some favorable conditions and circumstances that contributed to bring out the positive change. The attention of the decision makers, international society, donors to HIV/AIDS epidemic growth in our region, The new funding model of the Global Fund, which gives the opportunity to apply for regional proposals, and new procedures of Global Fund provides more opportunities for involvement of community, for work in the field of advocacy, for pushing positive changes inside the countries and across the region. Also, integration of the key affected populations into advocacy campaign on access to ART. Regional advisory group on scaling up access to treatment in our region was established by ECUO in 2013, and it includes the representatives from international organizations, NGOs, governmental organizations, and key affected populations. There were also challenging circumstances, political unstable situation in many countries in the region, wars, conflicts, frequent changes of government hinder the work in advocacy field. The disengagement and the polarization of the region processes are taking place rapidly. Often there is no possibility to have the time or resources to influence the processes, and also the misclassification of the World Bank. As a conclusion, we can say that mobilized people living with HIV advocacy efforts can ensure sustainable access to ART in 7 countries of region via increased state budget in ART and impact on national policies. And it's important to unite the efforts of people living with HIV community, state authorities, and all the stakeholders to ensure the inclusion of the item expenditure for ART procurement into the national budgets. And also, the proposed regional approach works at both regional and national levels to allow cross-border coordination for powerful and unified advocacy efforts, while providing flexibility for stakeholder-driven adaptations to country-specific contexts. Advocacy actions required to achieve necessary governmental decisions are extremely difficult, sometimes even impossible, to carry out within the existing GF national grants implemented in close conjunction with government and agencies, which are usually pretty reluctant to support community advocacy efforts. And this model of regional approach, it gives the possibility to influence in such a way. And the next steps is to continue implementation of the regional advocacy campaign on access to RT, to ensure linkages between the prevention and treatment programs, to advocate on increasing the state funds for attraction of people living with HIV, in particular from the key affected groups, into the testing and treatment programs and their retention, and advocate for approval of the official plans of transferring services financed from the Global Fund projects to the state financing in Eastern Europe and Central Asia region countries. Thank you very much.